CooperVision partnered with OT to explore the contact lens crossroads for myopic and presbyopic patients, and the role of the practitioner. This is a continuation of our Insight survey carried out with CooperVision in early 2026, which provided a lot of data for the framework of this discussion. But first, let's meet our ECPs who were involved in the conversation.
I'm Krupa Mystery. I'm based at a practice called Burnett Hodden Tam Optometry, which is in London. And I also work as a hospital optometrist at St Thomas's.
Sajal Patel. I'm a clinical performance consultant with Specsavers for two regions, Hertfordshire and Oxfordshire, Berkshire.
I'm Simon Callahan and I'm an optometrist at Rawlings Opticians and Hearing Care, and I'm based in Banstead in Surrey.
Hi, I'm Yasmin Ahmed. I work in Central Vision Opticians, which is based in Finchley.
Almost half of survey respondents thought that the contact lens journey would become more hybrid over the next 5 years. What do our ECPs think of remote care?
Patients have got a lot more busier. I find especially contact lens patients don't want to keep coming back in. So remote follow-ups I think have really worked well after COVID.
I think a lot of patients kind of get annoyed a bit when they have to come back again and again for their contact lens aftercares, just for us to kind of say, yep, everything's okay. Whereas I think some patients would like the idea of more of a remote system, but I'm not too sure how I feel about signing stuff off and not actually seeing it. So it's that kind of break between the two.
I tend to just actually give them my email address and say to them, keep me in touch, let me know how the lens feels, if you need to come back in, keep a bit of an open door policy with them.
They know that there's a framework for open dialogue and hopefully will reduce patient dropouts.
With that in mind, where do our ECPs think remote care brings the most value?
I see major opportunities when it's used appropriately. It encourages compliance if you've got regular touch-up points. But then also you've got the challenges of making sure that safety is thought about. If there's any red flag symptoms, they don't get missed.
We're in an era where people are self-prescribing because contact lenses are easily available on the internet. Having an open remote system where they can call in whenever they want, it might add value.
We did an audit many years ago about the number of contact lens new fits versus the ones that actually end up becoming full-time contact lens wearers. And it's actually quite surprising the number of dropouts you get that you don't actually realise. And sometimes it might just be stuff like they just can't get the lens in or can't take it out properly. And they may, the patient may blame themselves and think, well, I just can't do it, it's not for me. And then they cancel their appointment, don't come back. But I guess if you have those remote touch points where they know, actually, I can phone up or I can send an email or we'll get in touch, you probably would maybe reduce those dropouts because they may not want to come back in because they feel they're not good enough to come back in, but just having that remote care probably would make them feel more comfortable, I guess.
And how about the other side of the coin? Do they think there are any limits on how far remote care should go?
I think you have to have clear clinical limits.
We can't rely on self-declaration of symptoms. Quite often you see things on the cornea that the patient has no symptoms of.
So if you've got those patients who are wearing sclerals or RGPs or let's say myopic control lenses in children, you might be a bit more inclined to see them back a bit more routinely. I guess your soft lens patients who are quite straightforward, we're happy to probably say after the first initial fitting, we could maybe touch base hybridly.
One of the other areas we explored in our Insight survey was perceptions around presbyopia and patients' reactions to multifocal contact lenses. One of the findings revealed that 85% of respondents see multifocal contact lenses as critical or important to the future category growth. So what have our ECPs done that has worked in the past? Are there any must-haves to get a patient started on their multifocal journey?
For us, it's just having a trial bank of different types of lenses.
Sometimes you'll have the conversation and then it's that extra effort of, oh, I must come back or we have to order lenses in, which kind of ends up maybe being a negative thing and they end up saying, no, thank you. But if you have them there ready to go, they kind of think, well, yeah, why not try them and away they go.
They just want something that works rather than having to make a decision.
What doesn't work, I find, is setting unrealistic expectations and overcomplicating, possibly if they are confused about how it's going to affect everything. Just keeping it really simple and telling them, look, just try it out.
I think keeping it simple because, there are patients where the whole presbyopic conversation is actually a lot for them to take in.
But also really importantly, the lifestyle-based conversation is really important because if they don't feel that it's going to benefit their lifestyle and make things easier for them, it's not something they're going to want to do.
If they're previously a contact lens wearer, they're used to, oh, this is my prescription, I can see through it. So just managing the expectations that it is a process, that might not be the perfect option that they put in straight away, but if they understand that it might take a little bit of time to get to the end result, they are more positive about it.
I think also just introducing that conversation a bit earlier as well. So if you know your patient is an existing contact lens wearer, maybe if they're getting close to presbyopia, having that conversation about maybe next year when we come in, maybe updating it or changing it to a presbyopic contact lens.
I find that too, if you kind of let them know the information in advance, at least when they do come in, they say, actually, you said this is going to happen, you did pre-warn me, and they've already kind of thought, yes, I'm ready to go ahead. And they've kind of accepted it by then.
Or they notice that they're maybe struggling a bit more, and I find they come back soon and they think, okay, you know what, I'm actually ready for it now. I don't want to wait for my appointment.
Fitting multifocal contact lenses can be perceived as difficult. What challenges do our ECPs encounter, and what do they do to guide the patient through the fit?
I sometimes have a word with them about visual processing. I just explain how the lens works, and it's actually your brain that's picking out the information. And sometimes you have to your brain has to learn how to use them. I often find that after a week, the visual result is so much better.
Yeah, definitely that adaptation piece is really important.
You're just having that conversation of talking about how the lens works, how it's going to be for distance and for near. If they are someone that's used to really critical detailed vision, letting them know that will not be the case when we put the contact lens in.
Sometimes I find if you ask them to rate your distance, your intermediate reading, how much you need, how much clarity you need on each, or even when you put the lens in, I get them to go away, come back, and I tell them to grade what the distance, intermediate, and close-up vision is. That kind of gives a good expectation of what they want to achieve and also what I can give them out of the lens.
Your patient in terms of their lifestyle is really key, like Sejal was saying, because I guess if you've got those patients who are so used to having super crisp, like HD vision for the distance, and then you pop them into that multifocal, it's just giving them that advice of expectation as well. And like Yasmin was saying, just giving it some time and educating the patient when you pop them into that type of lens.
What do our ECPs do to ensure that they remain confident when fitting multifocal contact lenses?
I think confidence is a big thing. I think patients can kind of smell it off you if you're not confident. So when you've got a pre-reg or a newly qualified and they're trying to convince a first-time presbyope patient to get a multifocal contact lens, they can already sense hesitation.
It's nice that there are more products available, because then if one doesn't work, you're not thinking, okay, we're stuck. You have got other options available. Because I think some patients again think, well, this is my multifocal contact lens. If one doesn't work, then they all don't work. But it's trying to let them know that they all work differently in different ways.